Treatment to the prostate gland, regardless of the technique that is used, causes some degree of side effects and difficulties. If you've talked to a surgeon, then you're aware of some of the difficulties that can arise with radical prostatectomy or surgery to remove the entire prostate. Regardless of the technique that is used, there are some potential hazards with that approach. These are expected. With radiation therapy, generally the side effects and difficulties are somewhat less, particularly with the technique that we call intensity modulated radiation therapy, which constricts the dose of the radiation very tightly to the prostate. The side effects are relatively few. Because there is radiation to the base of the bladder and to the tube that leaves the bladder and passes through the prostate, then it is fairly common to have some burning and stinging with urination and some increased frequency of urination. On occasions, men will complain of increased urgency of urination, or a sense that when they have to go, they've got to go right now. Because the anterior wall of the rectum, or the front part of the rectum, is right up against the prostate gland, then that area too gets a small amount of radiation. Sometimes this causes increased frequency of bowel activity, which requires the use of small doses of anti-diarrhea medication. When we use seed implantation, or radioactive permanent seed implant, also called brachytherapy, for treatment of prostate cancer, then the dose to the prostate is actually even greater than when we use external beam radiation therapy. The dose is very tightly retained within the prostate and constrained from going into the tissues around the prostate, because we place the radioactive sources directly into the tissues of the prostate gland. But the dose is so high that nearly always the urinary tract, that is the base of the bladder and the urethra, or the tube that passes through the prostate, gets some irritation or inflammation from the radiation therapy that they receive. Nearly always with seed implantation, men will complain of some burning and stinging with urination, some frequency of urination that takes place or begins starting anywhere from a few days after the seed implant to as long as 2 or 2.5 weeks after the seed implant. On the average, most men have very few side effects for the first week or week and a half, and then they begin to have burning and stinging. Often they'll wonder why it took that long to start having the side effects. This is because even though the dose was delivered immediately and begins to give off from the seeds right as they're placed in the body, it takes a while for that inflammation to develop. And as it develops, then the burning and stinging comes on. There are medications that can improve these side effects, but there are no ways that we can completely prevent the possibility of inflammation from radiation. This is an expected side effect. Regardless of which of these techniques is recommended and which one you would choose to have, they all offer a higher probability of complete eradication of the tumor than we were able to achieve even just 10 years ago. The risk of recurrence of prostate cancer after treatment is relatively low if you have prostate cancer in the low risk range. What risk remains after aggressive treatment of your prostate cancer is spread out over about 15 or 20 years. So year by year, the risk is relatively low. Occasionally, prostate cancer needs treatment that will be systemic, or in other words, throughout the body. This is particularly true with very high-grade cancer or more advanced cancer. Of course, when the cancer is already spread outside the prostate, then it's important to control it wherever it may be. Most of the time, the way that we go about this, or the most common way of going about it, is hormonal modulation. Some people would refer to this as anti-hormone therapy, or a more scientific term would be androgen ablation. Various techniques can be used to achieve this. The goal would be to suppress the male hormone, testosterone, to very low levels. And what this does is it keeps the prostate cancer cells from growing. It puts them into a state of suspended animation. Basically, they don't completely die off, but they don't grow at all. They just sit there, and they can sit there for many years as a result of androgen ablation. So this is a very good technique when it has to be used. It is very unlikely that a man will have life-threatening difficulties related to his prostate cancer. It still happens when we see rapid growth prostate cancer. Occasionally this occurs, but it's rare. Most prostate cancer is medium grade, moderately differentiated, cancer that is relatively slow growing compared to cancer from other sites. Because of this, we're able to control the disease very well in the prostate gland and the surrounding tissues. And by doing so, we can cure the vast majority of that prostate cancer. And the part that is not cured is generally detained.